Hello, my name is Jared Murphy. I work at UnityPoint Health St. Luke's Hospital in Cedar Rapids. Today I'm going to be talking about healthcare careers, and then more specifically careers in healthcare and data analytics. So I wanted to touch on just healthcare careers in general. I think when the average person probably thinks about healthcare careers, they probably picture doctors, nurses, maybe pharmacists, but that's about it. However, the field is much more diverse with opportunities for everybody. There are things like CNAs, pharmacy technicians, physical therapists, radiology techs, dietitians, and then there are jobs that aren't clinical, people with business and financing backgrounds, accounting, quality, regulatory compliance, human resources, and information technology. I truly believe that there's something for everybody, regardless of your education level, your background, your interest. So if you're sitting here listening to this and you're just not really sure what you want to do in terms of a career, I highly recommend that you give healthcare a look. The other really great piece of it is it's a growing field. According to the Bureau for Labor Statistics, the healthcare occupations are projected to grow 15% by 2029, with an additional 2.4 million jobs added during that time frame. That growth of 2.4 million jobs is higher than any other occupational category. A large reason for this is because the United States is an aging population, so we're getting older, we're living longer, and as you get older, you tend to need more healthcare services. So that means not only is there a lot of opportunity now, but it's a field that's very secure and definitely not going anywhere in the future. So next, I kind of just wanted to give you a little bit of background about myself. I went to Dyke New Hartford High School, which is about an hour north of Cedar Rapids. I graduated from there in 2012. I ended up having a BA in mathematics and my master's in business administration with an emphasis in healthcare management. However, during college, I changed my mind several different times. I kind of felt a little lost, wasn't quite sure what the right fit was for me. Right out of college, or right out of high school, I thought I wanted to be a pharmacist. I loved math, I loved science, chemistry was also one of my favorite classes. So it really felt like a good fit. I started working as a pharmacy technician to kind of get a sense of what the day-to-day life of a pharmacist looks like. And at least in a retail setting, it felt very repetitive and slow. And that wasn't really what I wanted for the long term. So then I considered actuarial science and considered working at a health insurance company. But that kind of felt to me like the wrong side of healthcare. I wanted to be a little bit closer to patient care, not necessarily doing patient care, but I wanted to help people, and it really didn't feel like I'd get that opportunity working at a healthcare insurance company. I then came across a job for a data analyst role at a different UnityPoint affiliate. When I read that, it kind of clicked with me. I thought this is exactly the kind of work that I want to be doing. So I took that job post while I was still in school. I knew they wouldn't hire me, but I kept it, and I kind of used that as my guidepost in terms of next steps. And I switched my major to mathematics. I looked for job openings within UnityPoint because I wanted to network and build connections and kind of get my foot in the door. So I took my current experience as a technician. I accepted a part-time role as a pharmacy tech, went on the job shadows, made those connections, and after a year of doing that, I accepted my current role as clinical data advisor here in Cedar Rapids. So healthcare analytics in general, very broadly, is analysis focused on offering insights into hospital management, patient records, costs, diagnosis, and lots of other smaller pieces of information. In my current role as clinical data advisor, I'm focused on the clinical and quality side of things. So I'm looking more at patient records and diagnosis versus cost, which is primarily handled by our financial analysts. So when I think about my day-to-day activity, there's typically about 3 different groups of projects that I'd be involved in. The first would be patient-level projects, where I'm trying to identify specific patients that are falling through the cracks or are not getting the services that they need. One example of this is we keep track of emergency room high utilization. So if you come to our emergency room, 12 times in a year, you probably end up on one of my reports. So then it's my job to kind of go in and look at this patient, see why they're coming in. Is it the same diagnosis every time? Are they coming in for different issues? The issues that they do have, is it making the most sense for them to be managed in the emergency room? What time of day are they coming in? So a lot of times the people that come in the middle of the night, they aren't really sick. I mean, they could be managed in an urgent care or with their doctor, but it's the middle of the night and the only place open is the emergency room. Versus if it was in the middle of the day, they may have chose to go somewhere else to meet their healthcare needs. The other things we kind of look at is there other services that we can offer this patient to help keep them out of the hospital. So do they qualify for a care manager or a caseworker, or have they met with a social worker? Do they need to meet with somebody on our palliative care team? We try to wrap as many services as we can around patients to help them stay healthy and out of the hospital. On a population level, we're looking at subsets of patients that have something in common. So is it diabetes patients or patients that just had total knee replacements or heart failure patients? And we just keep track of the quality of care that we're giving these patients. One example, within the diabetes population, we do track A1C control. So the ideal number for a diabetic is to have an A1C less than 8. So we keep track of the percentage of patients that we see regularly that are well controlled and less than 8. And then if they're greater than 8, what can we do to help them? What percentage of them are followed by an endocrinologist, which would be a specialist? Or how many of them attended diabetes education? How many of them are compliant with their medication? Are there things that we can do to better help this population? I guess I should explain what an A1C is for those that don't know. An A1C is a blood test that you get done that kind of measures your average glucose or sugar levels. You don't want that to be too high or it puts you at risk for other conditions like chronic kidney disease or heart failure. Or it also puts you at higher risk for complications if you have surgery. So it's definitely something we want to control to prevent other future issues from arising. The last level would be like an all-patient project. An example of that would be readmission rates. So we look at every person that's discharged and then the percentage of them that end up back in the hospital within 30 days is typically the window we look at. We keep an eye on those rates. There are often financial penalties if too many people are coming back to the hospital. It's also a really good indicator of the quality of care that they received during that initial hospitalization. We want to make sure that you are happy and healthy enough to go home and make that transition effectively. So we do a lot of work around readmissions. Excuse me. So healthcare analytics is really important as a field. More and more, healthcare spending is a big hot topic right now. It's covered a lot by the news. The government's talking about it a lot. There's lots of different pieces of legislation on how best to combat that. That's because the United States spends a lot of money on healthcare, more per capita than any other developed country, almost double the average of developed countries, as you can see in this chart below. That comes from the Kaiser Family Foundation. So it's a big issue, especially given that our healthcare outcomes aren't significantly better than any of these other countries. So definitely lots of opportunity there. The other big piece of it that has kind of allowed analytics to grow here as of late is the implementation of the electronic health record. So an electronic health record is basically a computer system that stores all the information about your doctor's visits and your hospitalizations. So we keep track of all your vitals, your height, your weight, your diagnosis, your procedure, doctors you saw, nurses you saw. All that gets stored in our computer system, and then I kind of go in and pull the relevant pieces of information from my various reports so that we can gain a deeper insight to potential gaps in care. Part of the issue that I have is up to 80% of that data is stored in what's said to be unstructured. So it's really hard to get the information in a meaningful way. The data is there, but it kind of just floats out there. You need to pull in other pieces of information from other parts of the system to really drive improvement or see the full picture. Part of that is there's lots of other subsystems that store this information that prevents us from combining it all directly into one report. So I've got to run 5 or 6 different reports to get all the data pieces that I need, and then find a way to cleanly merge those together to get the whole picture. This is going to become more and more important. The healthcare industry is changing from a volume-based reimbursement to a value-based reimbursement. So what that means is when you go to the hospital, it used to be that insurance companies would pay hospitals for every single medication you took, every procedure you had, all the supplies you used. It was just straightforward. This is what we used on this patient. Here's the money that we owe you as an insurance company. The issue with that is it almost incentivizes hospitals and healthcare organizations to have you keep coming back to the hospital because then we can charge you for more medications, more supplies, more procedures, which doesn't quite seem right. So instead we're switching to more of a value-based reimbursement model. So how that works is if you, as a patient, stay out of the hospital, you don't get readmitted, you go see your primary care doctor, you get your flu shot, things like that, that are going to help reduce the amount of money the health insurance companies have to pay out. That money they're saving, part of that gets reverted back to hospitals as a reward for taking really good care of the patients. This is a growing way of reimbursement. It's going to become pretty much the standard across the board here in the next few years. So it's really important that we have analysts that are able to really drive improvement and identify those areas of opportunity. So some key skills that I think are really important for data analysts to have, I would say creative problem solving is the biggest one. Every single day there's a new problem or a new request that I have no idea how I'm going to do it, how I'm going to get that information. It takes a lot of running various different reports, piecing it together, and then validating and cleaning it up. So being able to look at the different pieces that I have available and fitting them together the best way possible to get the information out to my end users is really important. I would say communication is also crucial. With data analytics, there's probably 100 different ways that I could present you the average length of stay of our patients at the hospital. It's really important that A, that I present it accurately, and B, that I provide the correct insight and additional information to give that audience the full picture. So for example, if I'm looking at length of stay in the emergency room, I might not need to explain in as much detail what processes we have in place in the emergency room that's helping us improve our length of stay because I'm presenting it to the staff that's already doing the work. Whereas if I'm presenting the same information to some executives who aren't as close to the work, they're going to want that background, they're going to want that context, so they can really get a sense of what we're doing and why it's working and that performance. Flexibility and time management kind of go hand in hand, at least in my mind when I think about it. You've got to be able to put something down and come back to it the next day because there are new requests constantly coming in, and more often than not, you have very tight turnaround windows. Sometimes I get something at 8 o'clock in the morning and I need it by 10 a.m. So, I gotta drop what I'm doing, shift gears quickly, focus on this, get this done and out, and then quickly revert my attention back to my original project, which is due at the end of the day. So being able to balance that and shift gears pretty quickly is really important. So this next table here comes from the Iowa Department of Education. It kind of looks at healthcare, it looks at data analytics careers regardless healthcare or not. I just kind of the different levels of experience that you might need to have, different levels of schooling that you might need to have, and then the kind of average range of salaries that you would expect within the state of Iowa. So obviously there's going to be a little bit of difference depending on where you're at geographically in the state. And then obviously if you look outside the state of Iowa, you're going to see some variability here. But I still think it's a good gauge of the different levels. I think there's opportunities to start no matter where you're at in your career if you're interested in healthcare analytics, and there's lots of good money to be made in the field as well. So if you're interested in either A, a healthcare career, or B, an analytics career, or C, a healthcare analytics career, I think that these are good tips across the board. I think volunteering is a great thing to do. St. Luke's has got a really great volunteer program. I don't know how many people they have, but I do know they have people of all ages, high school, college, all the way up to post-retirement age. People volunteering their time at the hospital. I think this is a really great way to kind of get a sense of how day-to-day operations of a hospital work. It's kind of a good first step to get your bearings and to get an understanding of healthcare. Other opportunities include job shadows or internships. Right now, I don't know. I don't think the hospital is doing job shadowing due to COVID, but as things start to go back to normal, that's definitely another potential that you should explore. I did a job shadowing experience. I think it really solidified that I was on the right path. This was the right career for me. It was also the right organization for me, which I think is really important, finding an organization that has a good culture that you will fit into well. And job shadowing and internships kind of give you that insight. The next piece of advice I would have is to start checking out those job boards. Even if you're not ready to start applying to things, it's a really good idea to kind of get a sense of what's out there. What companies are looking for in terms of education, for experience. So you can maybe tailor your course load to that, or look for volunteer opportunities that align with those future goals. I still get weekly alerts to potential jobs that I might be interested in, just so I can stay fresh on what's going out there, where things are heading, what kind of experiences I need to be working on to have to better prepare myself in the future. And then in terms of coursework, computer science is a big one. I had wished I had taken some courses in computer science, learning some coding, things like that. Can really be helpful in some of these analytics roles, especially as you get more advanced. They're looking for people with those kinds of backgrounds. Statistics, I got a little bit of statistics, being a math major, but definitely could be a little bit sharper there as well. So I definitely think those are two big areas. And then anything healthcare related, I know there's lots and lots of opportunities, whether it's nursing or pharmacy or whatever it may be. There's lots of educational opportunities out there. Um, I think healthcare analytics, when I look at the people that I work with, it's very diverse, even within the field itself. I mean, there's people with pharmacy backgrounds, dietary, HR. There are people that went to school specifically for data analytics. There are finance people. So healthcare analytics is a potential opportunity maybe down the road if you as you start to explore things and you get some experience in a couple different areas. I think long term it could be a potential opportunity for you to look at. So if you have any questions or want to discuss anything further, feel free to shoot me an email. My email address is below there. I also encourage you to go talk to your counselors and your resources that you've got while you're in school. They probably have a better idea of volunteer opportunities, internships, things like that. So I really recommend you take advantage while those things are there, because they won't always be there. But yeah, shoot me an email, let me know. Thank you guys so much for taking the time to listen to me, and I hope you have a great rest of your day.